Africa has adopted a new strategy to boost access to the diagnosis, treatment, and care of several non-communicable diseases. This new strategy is called PEN+. It is a regional strategy to address severe non-communicable diseases. This strategy is aimed at bridging the access gap in treatment and care of patients with chronic and severe NCDs. At the 72nd session of the World Health Organization Regional Committee, the health ministers of African countries endorsed the plan for Africa in Lome, Togo, to reduce premature mortality from non-communicable diseases. Globally, non-communicable diseases are the main cause of morbidity and mortality. They account for 71% of global mortality according to the World Health Organization. In the African region, the proportion of mortality due to non-communicable diseases ranges from 27 to 28%. The four major non-communicable diseases are cardiovascular disease, cancer, chronic respiratory diseases, and diabetes. Severe non-communicable diseases are those chronic conditions that lead to high levels of disability and death among children, adolescents, and young adults if left undiagnosed or untreated. In Africa, the most prevalent severe non-communicable diseases include sickle cell disease, type 1 and type 2 diabetes, rheumatic heart disease, severe hypertension, and asthma. Sickle cell disease is an inherent blood disorder that shortens red blood cell survival that causes anemia. More than 66% of the 120 million people affected worldwide by sickle cell disease live in Africa. Approximately 1,000 children are born with a sickle cell disease every day in Africa, making it the most prevalent genetically acquired disease in the region. Mortality from non-communicable diseases in the African region has increased to 37.1% in 2019, which was 24.2% of the total deaths in 2000. In many parts of Africa, serious non-communicable diseases are treated in health facilities in major cities. This puts care out of reach for most rural and non- or low-income individuals. Only 36% of countries in the African region reported having essential medicines for non-communicable diseases in public hospitals, according to 2019 WHO survey. The PEN+ strategy urges countries to standardize programs to tackle chronic and serious non-communicable diseases by ensuring that essential medicines, technologies, and diagnostics are available and accessible in district hospitals. Let's take a look at the position of India. In India, nearly 5.8 million people, according to the World Health Organization report 2015, die from non-communicable diseases, especially heart and lung disease, stroke, cancer, and diabetes every year, or in other words, 1 in 4 Indians have a risk of dying from a non-communicable disease before they reach the age of 70. There is an increase in the contribution of non-communicable diseases from 30% of the total disease burden disability adjusted life years in 1990 to 55% in 2016, and also an increase in proportion of death due to non-communicable diseases from 37% in 1990 to 61% in 2016 among all deaths. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke has increased awareness of risk factors and set up infrastructure. India is the first country to adopt the National Action Plan with specific national targets and indicators aimed at reducing the number of global premature deaths from non-communicable diseases by 25% by 2025 year. Integration of Ayurveda, Yoga, Unani, Siddha, and homeopathy means Ayush with the National Program for Prevention of Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke is a further step for promoting healthy lifestyle changes among the population. That's all in today's session. See you soon.